Now let's see some of the structures in the scalp and face region. So we have dissected the scalp and we can see this area here. So skin is removed, superficial fascia also removed. You can see the fat in the superficial fascia, and here we can see some of the muscles here. These pink color area or brown color area, these are the frontal belly of occipitofrontalis muscle, and also you can see this structure here to which the frontal belly is attached. This is called epicranial aponeurosis. Then below that we can see loose connective tissue, and this white area here which I am touching, that is pericranium. So scalp has got 5 layers: skin, superficial fascia, then the muscle layer and the aponeurotic layer, that is frontal belly of occipitofrontalis, and also there is posteriorly occipital belly, and both of them are attached to the epicranial aponeurosis. Below the epicranial aponeurosis, loose connective tissue, loose areolar tissue. Then after that, this white area here, that is pericranium. We can see some of the nerves here. This is supratrochlear nerve, supraorbital nerve. Then we can see clearly here there is a nerve, that is auriculotemporal nerve. Auriculotemporal nerve accompanies this structure here. This is superficial temporal vessels, which is branch of external carotid artery. There is one more nerve which we may see here laterally here, that is not seen in this specimen, that is called zygomatico-temporal nerve, that we cannot explore. But otherwise the 4 nerves, sensory nerves, can be seen here. 3 sensory nerves can be seen here in the front: supratrochlear, supraorbital, one more is zygomatico-temporal, which is somewhere here. Then here it is auriculotemporal nerve. And moving on to the muscles here, this muscle here, this is called orbicularis oculi muscle. Now here near the nose, somewhere here, you can see some fibers. These are the muscles of, or these are called levator labii superioris aliquo nasi. These muscles fibers here. Some of the muscles can be seen here. These are levator labii superioris, which is going to the lip. Here zygomaticus minor, this is zygomaticus major. Here you can see some muscles. These are orbicularis oris muscle, and this side there are some muscle fibers. These are the depressor labii inferioris muscle, and this side there are some muscle fibers. These are mentalis. This is zygomaticus major. And this side, as we go to the lateral side here, we can see here, this is the area where you can see the parotid gland. We can see the parotid gland tissue here, and there is a duct which is arising from here. This duct, this is called parotid duct. This is parotid duct that is going to the vestibule of the mouth. There are some nerves here which are branches of facial nerve, which are coming from the anterior border of the parotid gland, naming here, this is upper buccal branch. These are zygomatic branch. And these are the temporal branch of the facial nerve. So temporal branch, zygomatic branch, upper buccal branch, this is lower buccal branch, and this area here, marginal mandibular branch, which is very near to the mandible. And below here, these are the cervical branch of the facial nerve. Here we can see this muscle here, this is sternocleidomastoid muscle. Also you can see here there is an artery here. This artery is facial artery, and this muscle here, this is masseter muscle. So in this area we can see here there is a muscle, pinkish area here. This muscle is platysma muscle, which is arising from pectoral fascia. It is going to the base of the mandible. This area, this is mandible, base of the mandible. Below the mandible here, this area, we can see some of the lymph nodes. These are called submandibular lymph nodes. This area is submandibular region. The artery can be seen again once. This is facial artery. Look at the relation of facial artery with the masseter. Facial artery is appearing on the anteroinferior aspect of masseter. We can feel the pulsations of facial artery on the anteroinferior border of masseter. Facial artery runs in the face. We can see the tortuous course of facial artery, which is giving many branches in the face, and it is going to end as angular artery here on the face, somewhere here. You can see the branch here. Yeah, the continuation of the facial artery here can be seen, like this one. This is going to continue as angular artery. Posterior triangle is bounded anteriorly by posterior border of sternocleidomastoid, posteriorly by the anterior border of trapezius, inferiorly by the superior aspect of clavicle, middle 1/3 of the clavicle. Apex is formed where the sternocleidomastoid and the trapezius meet with each other, somewhere here. That is near the occipital bone, superior nuchal line of occipital bone. The posterior triangle is divided into two. The upper one is called occipital triangle. The lower one is called subclavian triangle or supraclavicular triangle. This division is done by a structure here. The structure here, that is called this one, inferior belly of omohyoid. Inferior belly of omohyoid divides this whole posterior triangle into upper triangle, that is called occipital triangle, and this triangle, that is called supraclavicular triangle or subclavian triangle. So this is inferior belly of omohyoid, and here you can see an intermediate tendon of omohyoid, inferior belly, intermediate tendon of omohyoid. Then this is the superior belly of omohyoid. Intermediate tendon is placed below the or behind the intermediate tendon is placed behind the sternocleidomastoid. Now let's see the structures in this region. We can see the structure here. This structure is crossing the sternocleidomastoid and it is draining into a vein which is placed here, this vein here. And this vein is subclavian vein, and this structure here is external jugular vein. External jugular vein has some tributaries. We can see one of it here, this one. This is called posterior jugular vein. Posterior jugular vein travels on the posterior border of sternocleidomastoid. Then there is another vein here that can be seen. This is called transverse cervical vein of neck. So this is called transverse cervical vein, that is also draining into external jugular vein, and this vein here is a subclavian vein. There are some nerves that can be seen here, as we discussed before this one. So near the posterior border of the sternocleidomastoid, here we can see a nerve. This nerve is spinal axillary nerve. Spinal axillary nerve supplies sternocleidomastoid and the trapezius also. There is a nerve which is hooking the spinal accessory nerve here, this one. So this is spinal accessory And here you can see this nerve, this one. So spinal axis, you can see the hooking. So this is the lesser occipital nerve, spinal accessory nerve. Then we can see a nerve here, this one. This is great auricular nerve that is going towards the auricle. Then there is another nerve here that is called transverse cervical nerve, which is going to the anterior aspect of the neck, which is going to cross the sternocleidomastoid. So there are two nerves which are crossing the sternocleidomastoid. One is transverse cervical nerve. It is also called as anterior cutaneous nerve of neck. And this nerve, which is going to cross the sternocleidomastoid obliquely, and this is great auricular nerve. Also some other nerves can be seen here. Here you can see some nerves, sternocleidomastoid on the posterior border. Here you can see again 3 nerves here. These are the supraclavicular nerves. Medial, intermediate and lateral supraclavicular nerves can also be seen here. Now we can see some muscles which are forming the floor of posterior triangle. This muscle here, this is splenius capitis. Now this muscle here, anterior to the splenius capitis here, this is levator scapulae. And here this muscle, this is scalenus medius, and this muscle here, that is scalenus anterior. So scalenus anterior, scalenus medius, levator scapulae, splenius capitis. Now as you go to the lower aspect of the posterior triangle, that is a supraclavicular triangle or subclavian triangle. It is called subclavian triangle because we have got a subclavian vein here, also subclavian artery. So let's see a key muscle in this area, that is scalenus anterior. Now anterior to the scalenus anterior, there is subclavian vein. Whereas posterior to scalenus anterior, this structure here, that is subclavian artery. So this muscle is scalenus anterior. Posterior to the scalenus anterior, this is subclavian artery. Also we can see this structure here. This is the trunk here. This is the lower trunk of the brachial plexus, lower trunk. This is middle trunk, lower trunk, and this one is upper trunk. So upper trunk of brachial plexus, middle trunk, and then this is the lower trunk. So we can see that the subclavian artery is closely related posteriorly with the lower trunk. So this is the lower trunk. And in this area we can see some nerves. From the upper trunk we can see a thin nerve here, slender nerve here. This is nerve to subclavius, which supplies subclavius muscle. Then we can see some nerve here, which is this nerve. This nerve is penetrating a muscle, that is scalenus medius. So this is scalenus anterior, and this muscle here, this is scalenus medius. So there is a nerve here. This nerve is penetrating the scalenus medius and coming out here, this one, and this is called dorsal scapular nerve. Dorsal scapular nerve. And this nerve, which is coming from the upper trunk again, this is called suprascapular nerve. So from the upper trunk there are two nerves, nerve to subclavius, and this is suprascapular nerve. So here this muscle is scalenus anterior. Now on the anterior aspect of the scalenus anterior, there is a nerve, the nerve here. This nerve is called phrenic nerve. Phrenic nerve. This one. This is phrenic nerve, which is lying on scalenus anterior. Phrenic nerve supplies diaphragm. Phrenic nerve is arising from the root of brachial plexus. Phrenic nerve. Upper trunk, middle trunk, and the lower trunk of brachial plexus. Now there's an artery here. This artery. This artery is arising from the subclavian artery, first part, from the thyrocervical trunk. This is called transverse cervical artery. So you can see it is arising from the subclavian artery, first part. Subclavian artery, which we have seen here, it has got three parts. This is divided by three parts by the scalenus anterior. So there is a part that is proximal to the scalenus anterior, that is first part. The part that is deep to the scalenus anterior, that is the second part. So this part that is deep to the scalenus anterior, this is second part, and the part that is distal to the scalenus anterior, this part, that is the third part. This is upper trunk, middle trunk, and this is lower trunk. And here there is a nerve, this one. This nerve is running behind the trunks, and this is long thoracic nerve, which supplies serratus anterior. There is a nerve which is running anterior to this trunks, that is anterior to the brachial plexus here, this one, which is arising from upper trunk, that is called nerve to subclavius. Now we will see the anterior triangle of the neck. So anterior triangle, the base of the anterior triangle is by the lower border of the base of the mandible, also a line joining from the angle of mandible to the mastoid process, that is the base of the anterior triangle. Now posterior boundary is by the anterior border of sternocleidomastoid, and anterior boundary is by the anterior median plane, that is from the chin up to the suprasternal notch. So this is suprasternal notch here, where there is a sternum here, sternum is cut, so somewhere here. Now the apex of the anterior triangle is where the sternocleidomastoid joins with the anterior median plane in the suprasternal notch. So this is the anterior triangle. The roof of the anterior triangle is formed by the investing layer of deep cervical fascia. So there are many small triangles that you can see in the anterior triangle. The anterior triangle is subdivided into many small triangles. One of the triangle that we can see here is carotid triangle. So carotid triangle is somewhere here. This region is carotid triangle. So carotid triangle is bounded antero-superiorly by this muscle here, This one. This is digastric muscle, posterior belly of digastric muscle. Also there is one more muscle along with that, that is stylohyoid muscle. So anterosuperiorly by digastric posterior belly, also the stylohyoid muscle. Now anteroinferiorly it is bounded by the superior belly of omohyoid muscle. This is inferior belly of omohyoid muscle. This is superior belly of omohyoid muscle. And posteriorly it is bounded by the anterior border of sternocleidomastoid. So this is here, this area is the carotid triangle. Now in the carotid triangle we can see many structures. So here we can see a structure here. This is the cervical branch of facial nerve, which is coming out from the parotid gland, the apex of the parotid gland. So this is the parotid gland here. This is the apex of parotid gland. So this is cervical branch of facial nerve, and here there is one more nerve. This is transverse cervical nerve or anterior cutaneous nerve of neck, which is coming from the posterior border of sternocleidomastoid. This is sternocleidomastoid. It is crossing this triangle. There are some veins that also can be seen here, like this one. This is lingual vein. Lingual vein is draining into internal jugular vein. Now this vein here, this is common facial vein that is also draining into internal jugular vein. The key structure here in the carotid triangle are carotid vessels. So here this structure here, this is common carotid artery. Common carotid artery divides into internal carotid artery and the external carotid artery. So this is common carotid dividing into internal and external. Internal jugular vein, which is lying lateral to the carotid artery. Sternocleidomastoid muscle. This is common carotid artery, internal jugular vein, and between common carotid and internal jugular vein, this is vagus nerve. Now all these are covered by carotid sheath. Here, posterior to the carotid artery, posterior to common carotid artery, here this structure, this is the sympathetic chain, cervical sympathetic chain. So carotid sheath, on the anterior wall of carotid sheath there is a structure that is called ansa cervicalis. So we can see ansa cervicalis here. Here we can see the loop of ansa cervicalis. This is the loop of ansa cervicalis. It has got two roots, inferior root, which is derived from C2 and C3, where it has got a superior root, that is here. So inferior root and a superior root. Superior root is arising from hypoglossal nerve. So here, this nerve here, that is hypoglossal nerve. So from the hypoglossal nerve, the superior root arises. So you can see the connection from the hypoglossal nerve, the superior root. This is hypoglossal nerve, this is superior root. Now the superior root will join with the inferior root and it forms ansa cervicalis. Ansa cervicalis supplies all the infrahyoid muscles. Infrahyoid muscles are also called as trap muscles. These muscles are supplied by the ansa cervicalis except a muscle that is thyroid. So let's see the strap muscles. Strap muscles are here. These muscles are arranged in two layers, a superficial layer and a deep layer. Superficial layer has got two muscles. This is the first muscle, that is called sternohyoid. The next muscle in the superficial layer, that is omohyoid, superior belly of omohyoid and the inferior belly of omohyoid. Now the deep layer are two muscles. This muscle here, that is sternothyroid, and the next muscle here, that is thyrohyoid. So superficial muscles of infrahyoid muscles are sternohyoid. So somewhere here is the hyoid bone, sternohyoid, omohyoid. The deep muscles are sternothyroid and the thyrohyoid. Thyrohyoid comes to the carotid triangle. So it forms a floor of one of the muscle which is forming the floor of carotid triangle. Can be seen here, external carotid artery. This is internal carotid artery. There is a dilatation of the internal carotid artery at the beginning, that is called carotid sinus. Now external carotid artery has got total of 8 branches. In that we can see 5 branches in the carotid triangle. So the first branch, which is arising from the medial aspect of the external carotid artery, that is ascending pharyngeal artery. The next branch that is arising from the external carotid artery, that is superior thyroid artery. Superior thyroid artery is meant to supply the thyroid gland. But superior thyroid artery, it gives a branch here. This branch is called superior laryngeal artery. Superior laryngeal artery accompanies a nerve, that is internal laryngeal nerve. Both of these structures are going to the larynx. These structures will pierce thyrohyoid membrane. Now, superior laryngeal, internal laryngeal nerve is a branch of superior laryngeal nerve, which is a branch of vagus nerve. Now, this is again the superior thyroid artery giving the superior thyroid artery, superior laryngeal artery, this one, and this is a continuation of the superior thyroid artery. It is going to continue and supply the thyroid gland. Now, as it is going to the thyroid gland, it is accompanied by a nerve here. This nerve is external laryngeal nerve. External laryngeal nerve is a branch of superior laryngeal nerve, that is a branch of vagus nerve. So here we can see external laryngeal nerve along with superior thyroid artery. This is internal laryngeal nerve along with superior laryngeal artery, which is a branch of superior thyroid artery. Superior thyroid artery is arising from the external carotid artery. Superior thyroid artery is arising from external carotid. Now the external carotid artery, posterior aspect of the external carotid artery, we can see the first artery that is arising from the posterior aspect here. This artery is called occipital artery. Occipital artery. Internal laryngeal nerve and external laryngeal nerve. So let's trace these back to the nerve here. This one here. This is the superior laryngeal nerve. So this is external laryngeal nerve. This is internal laryngeal nerve. Both are arising from superior laryngeal nerve. Superior laryngeal nerve is a branch of vagus nerve. External laryngeal nerve, external laryngeal nerve, and this is internal laryngeal nerve. Let's see the branches of external carotid artery. So this is external carotid artery, internal carotid artery, common carotid artery. So the first branch that is arising from external carotid artery is ascending pharyngeal artery. So this is ascending pharyngeal artery. as an infrapharyngeal artery. This artery is going to the pharynx. The next artery is superior thyroid artery. Then this artery, which is actually a common trunk here in this specimen. This common trunk further divides into lingual artery and facial artery. So we can see the facial artery here. So look at this here. When I pull this, you can see the movement. You can see the movement here in the facial artery. So probably here you can pull it now. So this is lingual artery and this is facial artery. Usually these two arteries arise separately from the external carotid artery, but here it is arising as a common trunk. Later, as you move upwards, we can see an artery which is arising from external carotid artery. This artery, this is occipital artery. You can see occipital artery is hooked by this nerve, that is hypoglossal nerve. Also the lingual artery is also hooked by, the lingual artery is also hooked by this nerve, that is hypoglossal nerve. So this is occipital artery and this is external carotid artery. We follow the external carotid artery. We are following the external carotid artery. So you can see this moving upwards. It is passing almost very near to the digastric muscle and stylohyoid muscle. So this is stylohyoid, and here you can see this area, that is digastric muscle, digastric and stylohyoid. Posterior belly of digastric can be seen, and the stylohyoid muscle. Now this artery here, that is external carotid artery, which is giving another branch here posteriorly, that is called posterior auricular artery. Then this artery is entering almost into the parotid gland. So this is parotid gland tissue. Now we are inside the parotid gland. Now here you can see this is the external carotid artery. At this point, the external carotid artery divides. Here divides into one deep artery here, that is maxillary artery, which is going behind the mandible. This artery here, that is superficial temporal artery, which can be traced here also, superficial temporal artery. So the division is occurring here. So this is superficial temporal, and the one that is going deep, big one, that is maxillary artery. So we have seen the branches of external carotid artery in this. So the branches arising from the anterior aspect of external carotid artery are superior thyroid. Then here it is lingual, facial artery. Branches arising from the posterior aspect of external carotid artery are occipital artery, and other one is posterior auricular artery. The terminal branches are superficial temporal, maxillary artery, and a medial branch that is arising from external carotid. This region is submandibular region. This is the base of the mandible. Here you can see a gland, that is submandibular gland. We are seeing superficial part of submandibular gland in this area, that is also called as digastric triangle. Digastric triangle. We will see the digastric triangle very soon. We can see this artery here, that is facial artery. Facial artery has got a very close relation with the submandibular gland. Now let's see the digastric triangle, which is also called as submandibular triangle. Let's see the boundaries first. Antero-inferiorly it is bounded by anterior belly of digastric muscle. Postero-inferiorly it is bounded by this muscle, stylohyoid muscle. Stylohyoid muscle is almost overlapping another muscle here, which is lying deep or very near to it. This one, that is posterior belly of digastric. Posterior belly of digastric is ending in an intermediate tendon here, and that is going to continue as anterior belly of digastric muscle. Intermediate tendon is hooked, or intermediate tendon is attached to the hyoid bone here by investing layer of deep cervical fascia. The base of this triangle is bound by the base of the mandible and a line joining angle of the mandible to the mastoid process. So that is the base. Apex is formed by the intermediate tendon of digastric muscle. So this is the anterior belly, posterior belly and posterior belly of digastric, and the stylohyoid muscle along with that. So this is the apex, intermediate tendon of digastric muscle. The structures here are, this is the submandibular gland. We are seeing superficial part of submandibular gland. Also we can see this structure, that is facial artery. Look at the relation of facial artery with the submandibular gland. Also you can see some structures like here, this is the submandibular branch of facial artery. Along with that, we can see a nerve. This nerve here. This nerve is called nerve to mylohyoid. Nerve to mylohyoid. So nerve to mylohyoid and submandibular artery, they are running together. Nerve to mylohyoid is a branch of mandibular nerve. Now again, deep to that, you can see, deep to this digastric muscle, here we can see a muscle, that is mylohyoid muscle. So we are seeing almost the posterior border of mylohyoid muscle, and the mylohyoid muscle has a posterior border and an anterior border. Anterior border is somewhere here. So anterior border of the mylohyoid muscle, that is of now left side, which is lying deep to this muscle, that is the digastric muscle. Somewhere here, so this is the digastric muscle. You can see the digastric muscle, and deep to that this muscle, that is mylohyoid muscle. So the anterior border of the mylohyoid muscle of the left side is joining with the anterior border of mylohyoid of the right side. So this is left side and this is the right side. So they join at the center here, and it forms a raphe here, a median raphe. This white sheet here, that is a median raphe, which is formed by the union of left and right mylohyoid muscle. On this side, we can see the right side anterior belly of digastric muscle. So somewhere near the posterior border of the mylohyoid muscle, you can see the submandibular gland will wind around the posterior border of mylohyoid muscle, and that goes deep. So that part of the submandibular gland, the part of the submandibular gland that is passing posterior to the mylohyoid muscle and lying deep to the mylohyoid muscle, that is the deep part. Whereas here this part is lying superficial to mylohyoid muscle, and that is superficial part of submandibular gland, which is a large part. Now if you retract this structure, that is submandibular gland, we can see that a small part of the submandibular gland is passing deep to the mylohyoid muscle, and also you can see this part here. This is the submandibular duct, which is arising from the deep part of the submandibular gland. So this is submandibular duct. You will see an area here that is called muscular triangle. Muscular triangle is bounded antero-superiorly by superior belly of omohyoid. This is superior belly of omohyoid. Anterosuperiorly by superior belly of omohyoid, postero-inferiorly by anterior border of sternocleidomastoid, anteriorly by a midline that is joining the hyoid bone up to the suprasternal notch. So this is the boundary of muscular triangle. Now here we can see some muscles which are called strap muscles, or they are also called as infrahyoid muscle. So this is your superior belly of omohyoid muscle. Superior belly and the inferior belly of omohyoid both are included in infrahyoid muscles. We are cutting the superior belly of omohyoid muscle. You can see some muscles here. This muscle, which is also cut here, this is called sternohyoid muscle. Sternohyoid. So we are cutting the sternohyoid muscle here. The next muscle, that is called sternothyroid muscle, that also is cut here, sternothyroid muscle. Another muscle which is included in the infrahyoid muscle, that is this one, that is called thyrohyoid. So sternothyroid, thyrohyoid. So remember, sternohyoid and the omohyoid, these are superficially placed, whereas sternothyroid and thyrohyoid, they are placed deep. So when we reflect the sternothyroid and the sternohyoid, you can see this area. This is the thyroid gland. You are seeing the left lobe of thyroid gland. We can see some veins which are running here. This is superior thyroid vein, and there is an artery which is nearby. This artery is superior thyroid artery. Also, when we expose these infrahyoid muscles, we can see this area. There is a muscle that is called cricothyroid muscle. Cricothyroid muscle is supplied by a nerve, this nerve that we can see. This is external laryngeal nerve, which is a branch of superior laryngeal nerve of vagus. So external laryngeal nerve and the superior thyroid artery, they are running very close to each other. Now let's see some of the structures in the anterior median plane of the body. This is symphysis mendae. Below here, this resistance is of the hyoid bone. Then this area, this is the thyroid cartilage, or angle of the thyroid cartilage, where the two lamina joins. In males it is called Adam's apple, which is very prominent. Then below that, here, this is cricoid cartilage, and we can see this muscle, that is cricothyroid muscle, moving from cricoid to thyroid. And below the cricoid cartilage here, that is very near to the thyroid gland. Here, this part, I am feeling the first tracheal ring, and this is the left lobe of thyroid gland, and it is connected to the right lobe of thyroid gland through this part that is called isthmus of thyroid gland. Superior thyroid vein here can be seen. This is superior thyroid artery. Superior thyroid vein will drain into internal jugular vein. This area is called temporal fossa. So we were dissecting the temporal fossa. This is the superficial fascia, deep fascia. Here it is called temporal fascia. When we remove the temporal fascia, we saw this muscle, that is temporalis muscle. This nerve is spinal axillary nerve, which is seen in the posterior triangle. Spinal axillary nerve here, it is piercing, or it is passing posterior to the sternocleidomastoid. But actually when you trace it, you can see it is penetrating the sternocleidomastoid, right? And we saw it, we were tracing it upwards, and we saw that now it is lying in the carotid triangle. Carotid triangle here, and we can see it is having a relation with the internal jugular vein. It lies lateral to the internal jugular vein. This is internal jugular vein. This muscle here is called the masseter muscle. This is masseter. It's the strongest muscle of the body, which is attached to the lateral aspect of the mandible. Medially, here we can see a muscle that is medial pterygoid. This is masseter. So mandible is sandwiched between masseter laterally and medial pterygoid medially. So in this specimen, we can see the mandible is cut. This is the coronoid process of the mandible. And here the head of the mandible is almost removed. And we have also removed a part of the ramus. And this is the base of the mandible. So we can see a muscle. This is masseter. Masseter is removed from the mandible. And here, as we cut the mandible, we can see this muscle here. These muscles. These are attached to the medial aspect of the ramus of the mandible, that is medial pterygoid. We can see a nerve here. This nerve is called nerve to mylohyoid. Nerve to mylohyoid. And there's an artery here which is nearby. This artery is inferior alveolar artery. So here this is nerve to mylohyoid originating from inferior alveolar nerve. Inferior alveolar nerve is a branch of mandibular nerve. Inferior alveolar nerve, before entering the mandibular foramen, it gives a branch that is nerve to mylohyoid. This is inferior alveolar artery, which is a branch of maxillary artery. Now in this structure here, that is maxillary artery. Maxillary artery has got three parts. So this part of the maxillary artery is called the first part. Now we can see a muscle here. This muscle. This is lateral pterygoid muscle. So we can see the maxillary artery is passing lateral to the lateral pterygoid muscle here. Maxillary artery, lateral pterygoid. Now this part of the maxillary artery is called the second part, that is present on the lateral aspect of lateral pterygoid. First part, second part. And the third part is after it passes between the two heads of lateral pterygoid. Lateral pterygoid has got two heads, an upper head and this is the lower head. So the third part will pass between the two heads of maxillary artery. So here we are seeing this whole area. This is the infratemporal fossa. Now here we can see this artery, that is inferior alveolar artery, which is a branch of maxillary artery, first part of maxillary artery. Now at this area we can see that the external carotid artery dividing into superficial temporal artery and the maxillary artery. This area is the temporal fossa. This muscle here, which is a fan-shaped muscle, is called temporalis. Temporalis muscle is passing deep to the zygomatic arch and it is getting attached to this part, that is coronoid process of the mandible. So you can see here the cut part of temporalis muscle. Also I mentioned this nerve, that is nerve to mylohyoid. Nerve to mylohyoid was seen here as well. Here, this is nerve to mylohyoid, which is now lying over the mylohyoid muscle. The deep muscle here, this one, that is mylohyoid. So we will see some of the branches of the maxillary artery, first part. So this one we have already seen. This is the inferior alveolar artery. Now here we can see a branch, this branch, that is middle meningeal artery, middle meningeal artery. So this artery here, which is arising from the maxillary artery, this one, that is middle meningeal artery. Middle meningeal artery is related to this nerve here, that is auriculotemporal nerve. Middle meningeal artery. This one here, this is middle meningeal artery, which is arising from the first part. Deep to that, there is an artery deep here, that is accessory meningeal artery, which is also arising from the first part. Today we will see the subclavian artery and the branches of it. So this muscle here, this is scalenus anterior. Scalenus anterior divides this artery, that is subclavian artery, into three parts. First part proximal to the muscle, second part that is deep to the muscle, and third part which is distal to the muscle. So let's see the branches of first part here. So this is the first part here. Now this branch here, which is going upwards, this is vertebral artery. Next to that we can see these branches here. This trunk here, this is thyrocervical trunk, vertebral artery, thyrocervical trunk. Thyrocervical trunk divides into, this is thyrocervical trunk here, which is dividing into inferior thyroid artery, transverse cervical artery, and suprascapular artery. There is one more branch which is going downwards, that is internal thoracic artery. This one, internal thoracic artery. So there is a nerve here, this is phrenic nerve. Now the branches from second part. So muscle is displaced now. This is scalenus anterior. So somewhere here we can see the second part. Here the branches are coming a little earlier. So here you can see this structure. This is costocervical trunk. Costocervical trunk divides into two branches. This branch, that is deep cervical artery, and this branch, this one, that is superior intercostal artery. So this is costocervical trunk dividing into deep cervical and superior intercostal artery. There is one more branch which is arising at this level. That's the third part. Actually, this artery is arising from the third part. This is dorsal scapular artery. So maybe the muscle is displaced here, so we are not able to see the exact relation. So this is scalenus anterior muscle, and this is the artery, subclavian artery. This is the subclavian vein, the left subclavian vein, and this is left internal jugular vein. So these two are going to form left brachiocephalic vein. So here we can see a structure. This is called the thoracic duct. Thoracic duct is the largest lymphatic duct in the body. So it drains into the junction between the left internal jugular vein and the left subclavian vein that can be seen here. So this is thoracic duct. So this bone is hyoid bone here, and there are two muscles here. Anterior belly of digastric. Here this is anterior belly of digastric, and there's a triangle here. That triangle is called submental triangle. So submental triangle base is formed by the hyoid bone. Apex is formed by the symphysis mendae, where the two digastric muscle, that is anterior belly of left side and the right side, they meet at this point. So this is the apex of the submental triangle, and this is the base of the submental triangle, and you can see the boundary on each side. And here we can see a muscle that is between the two belly of digastric, and also it is deep to the digastric muscle. Here this muscle, that is mylohyoid. So there are two mylohyoid, the left and the right mylohyoid, they meet at the center here, and that forms raphe here. Mylohyoid forms the floor of the mouth. The same mylohyoid can be seen on this side as well. So in this area we have cut the mandible and we have removed the attachment of mylohyoid muscle. So this muscle here, which we are able to see right now, this one, this is mylohyoid muscle. So this area here, this muscle here, this is mylohyoid muscle. So we can see this muscle here, that is mylohyoid muscle. So mylohyoid is like this, you can see it here. This is actually forming the floor of mouth. Now we cut the mandible. Now here we are seeing the posterior border of mylohyoid muscle, and inside it at the center here somewhere we saw the anterior border of the mylohyoid. The anterior border is joining with the other side mylohyoid. Posterior border is free here. So this muscle is mylohyoid muscle, and here you are seeing the posterior border of mylohyoid. And this muscle here, which is deep, this is submandibular gland, deep to these muscles, that is called hyoglossus. Now I am trying to put a forceps between mylohyoid and the hyoglossus. Now my forceps is in between mylohyoid and hyoglossus. Now some structures are there here which is related to the posterior border of mandible. Here we can see this gland. So this is submandibular gland. Submandibular gland was located like this. Actually, I removed it. Now you can see the groove here. This is actually the groove which is occupied by the posterior border of mylohyoid muscle. So it is like this now. Now there is a part of the gland that is passing deep to the mylohyoid posterior border. So this is the posterior border of mylohyoid. So this part of the submandibular gland that will pass deep to the mylohyoid. So it will pass deep to the mylohyoid. Now as it passes deep to the mylohyoid, so I am trying to show the deeper aspect of mylohyoid somewhere here, this part. Now here also you can see that here. So this is the deep part. So remember, this is superficial part of submandibular gland which is lateral to mylohyoid. This is the deep part of submandibular gland, which is deep to mylohyoid. Now from the deep part you can see a duct, that is submandibular duct. This duct is passing deep to the mylohyoid, that we can see. Now one more muscle that is related here, that is this muscle, this one. This muscle, which is arising from the hyoid bone, it's a greater corner of hyoid bone, and you can see this fibers here. This fiber that is moving upwards here also you can see. So these fibers are called hyoglosses. So look at the relation of hyoglosses with the mylohyoid muscle. So mylohyoid is lying here. This is submandibular gland, and here you can see this is hyoglosses. Hyoglosses can be seen from here also, this part. The hyoglosses can be seen. Now we will see some structures here in this area. Here we have removed the mandible. So here we can see the external carotid artery, which is passing behind the ramus of the mandible. So here you can see somewhere here the ramus of the mandible, posterior aspect. And here you can see this artery is giving a branch, the external carotid artery here. So it gives a branch, this one, that is superficial temporal artery, and this part is maxillary artery. Maxillary artery is going deep. Now here we can see some structures. So after cutting the mandible, this muscle here, this is medial pterygoid, and we saw some structures here, this one now which is cut here. So here this one is now to mylohyoid, and this is inferior alveolar now, and this is inferior alveolar artery which is arising from maxillary artery. Now there is one more now which is arising from the mandibular now here, this one. Now this now, it is called lingual now. Lingual now is between the medial pterygoid medially and the ramus of the mandible laterally. This now is running anteriorly, as we can see, and it is going to supply the submandibular gland. So let's see this now here. So this now is supplying. Here you can see some roots which are arising from lingual nerve, small roots here, which are going to supply the submandibular gland. Actually these lingual nerve will relay in a ganglion that is called submandibular ganglion. Submandibular ganglion will supply submandibular gland. After that again the lingual nerve will go anteriorly to supply the tongue and the sublingual gland. So look at the relation of this nerve, lingual nerve. Lingual nerve is passing now deep to the mylohyoid, right? So this is mylohyoid, and you can see this is lingual nerve, and it is lying superficial to this muscle here, this one, that is hyoglossus. Similarly, we can see an artery which is passing deep to the hyoglossus muscle, that is here. You can see this is the common trunk for lingual artery and facial artery. So this is lingual artery and this is facial artery. This is a common trunk arising from external carotid. So this lingual artery, look at the lingual artery, as I pull it, we can see that this area is moving, right? So this artery is passing deep to this muscle, that is hyoglossus, and hyoglossus divides this artery into three parts: a proximal part, that is before the hyoglossus, and a deep part that is lying deep to hyoglossus, and the next part that is distal to, that is not seen here, that is distal to hyoglossus. So first part proximal to hyoglossus, second part deep to hyoglossus, and third part distal to hyoglossus. So we can confirm that this is hyoglossus muscle here, this one. This is lingual artery. So here this structure here, this is parotid gland here. So parotid gland gives a duct, that is parotid duct. We were tracing the parotid duct. So as we trace the parotid duct is passing anteriorly, and this goes and penetrate this muscle here. This is buccinator muscle, buccinator. So it is almost piercing the buccinator and it is going to open into the mouth. So this is the parotid duct that is piercing buccinator muscle. Also you can see some nerves which are supplying the muscles, facial muscles. So this is zygomaticus major. So you can see it is supplying zygomaticus major.